Welcome back to Crossfire. Today is the first day you can go online and sign up for health care through the Obamacare exchanges. Now, many people tried. So many people tried, they crashed the system. Now, we're here with Democratic Senator Debbie Stabenow and Republican Senator Tom Coburn. Now, I want to go to you, as we were going to talk about at the break. Why is it the case, if this is such a terrible program, that so many people are signing up for, they're interested in it, that they're actually crashing the system?
Well, it may not be that it's the number, it may be the system. The system may suck. A couple of points I'd make. Number one is healthcare is a problem in our country. Yeah. You know, the difference is we had no Republican agree that this was the best way to fix it. Matter of fact, didn't get one Republican vote in the House or the Senate. So there was a way to do this where you didn't have this polarization in our country on healthcare. I would posit to you that the two things that are out of control in our country that we're not doing well on are healthcare and education. Sure. Both of those are majority controlled by the federal government. There's not anything the federal government does that doesn't cause things to cost more. You just name one that doesn't cost things to number. So why would we go in a direction that exacerbates the problems of the system that we have now? There's some good things in the Affordable Care Act. I won't deny that. As a doctor, there's some things. I fought insurance companies my whole life, so there's some great things in it that I'm glad are there. But the overall long-term system is it's going to cost us trillions of dollars with decreased actual.
I want to talk with you about those things that you like, but first let's hear.
Yes, let me just jump in there and say, when we talk about Republican support, remember that this is based on Massachusetts and what has been called Romney Care, which in fact everybody now loves. Rates have gone down. More employers are now covering people than before. And so what we're looking at is something that's actually based on private sector competition. Yeah. And it's also saying, you know what, if you have insurance, you ought to get what you're paying for. You can't get dropped. There's no pre-existing conditions.
So let me ask you about the mechanics of this, because the whole thing to me seems to hinge on the idea that you will coerce millions of young people, young healthy people, who really didn't want to buy health insurance before Obamacare to suddenly buy it, and in some cases buy it at a more expensive cost than before Obamacare. I'll just talk to you about Detroit, Michigan. 27-year-old single person will see a 150% increase in premiums thanks to Obamacare. If you build it and no one comes, doesn't this whole thing collapse?
Well, yes, except they're coming, because we saw crashing on the computers because everybody's coming.
But the right people have to come, right?
Let me talk to you about the 27-year-old who earns $25,000 a year in Michigan, who will be able to find, for the first time, comprehensive basic care starting at $80 a month. What we are seeing now across the country is 6 out of 10 people that haven't had insurance before are going to be able to find it for under $100 a month, including, and I have to keep stressing again, things like maternity care, preventative care, mental health, prescription drugs, doctor visits, et cetera, et cetera. And here's the other reality of that young person or anyone without insurance. They walk into the emergency room. They get care. We all pay for it at the highest rates possible. So everybody who has insurance is paying at least $1,000 more a year. Yeah. So where's the personal responsibility?
The reality. You respond, and then let me ask you a question. You respond, and let me ask you a question.
The reality to that is why would you pay $100 a month or $80 a month when you can pay a $95 fine, and if you get sick or get pregnant, you get care. Well, so the point is there's the economic.
We should have higher fines. I'm for having higher fines.
If you're going to have an individual mandate, you're going to have to make it economically incentive to put them into the group. And this bill does not do that.
Well, we could make the fines higher. I want to talk with you, because I know you've actually put a lot of thought into this, and I want to talk with you about this individual mandate, which has been demonized by a lot of people. My view of it is it's a very conservative principle. They should call it the individual responsibility mandate. Yeah. That nobody should be walking around in the United States without health care that could get it, without insurance that could get it, as the senator just said, expecting if they dive bomb themselves into the emergency room, we're going to pick up the tab. To me, the individual mandate is conservative. It also is honest, because I know a lot of Republicans say they want to keep this idea from Obamacare that nobody can be denied coverage. Well, hold on a second. You can't get something for nothing.
Yeah.
If sick people are going to take money out of the system, well people have to put money in the system.
So I don't disagree with you.
What's wrong with the conservative principles in Obamacare? Why don't you support those?
Well, here's the difference. Yeah. Is if you want to have an individual mandate, then get everybody the capability to have the same thing. All right. So what you do is, if you really believe what you just said, give everybody a refundable tax credit, and let everybody be on the same basis, and then let markets actually decide. The reason health care costs 50% more than it should in this country is because there's not a real market, and you're not going to get a real market with this. There's not going to be any transparency. So if you give everybody a refundable tax credit in this country, including the irresponsible biker who breaks his pelvis and we're all paying for, where the state, you're auto-enrolled if you don't enroll yourself in a high-deductible plan, so we actually really spread the risk. But we're going to have the government run and decide what you will get by the different plans. We've decided what you'll get rather than you deciding. Here's the thing that's going to happen. Here's what people are going to see. You're not ever going to see the same doctor year in, year out under this plan. You're never going to have the same care. You're never going to have the same access. It is not going to happen.
Well, let's your colleague respond.
Time out. First of all, in Michigan, right now, there are 43 different plans. All we're talking about is allowing small businesses and individuals to go into an insurance pool so they can get the same kind of rate, have the same kind of clout as GM.
The small business pool isn't even available right now.
Yeah, it is coming online, and the folks can go online now. In another month, they're going to be able to sign up. There is no evidence, zero, that folks are not going to be able to see the doctor that they want to see. None. Ask the folks in Massachusetts.
Well, let me give you the evidence.
Not true.
In the evidence, in New Hampshire,
not true.
12 of the main hospitals aren't even in the group. So if you live in New Hampshire, here's 12 hospitals you used to be able to go to. You can't go to any of them now.
Well, all I can tell you is that across the country, first of all,
so there's no proof. You just said there was no proof.
Michigan,
that is true.
Not true. I have no idea what's happening in New Hampshire right now.
Idea. That's why we're making claims that aren't accurate.
In New Hampshire, maybe we need to kind of figure out what they're doing in New Hampshire. But all I can tell you,
they've been on the group.
Michigan,
let me give you
that is not true.
Well, let me give you a better example, and you tell me what's wrong with this. In Arkansas, which is a good red state, they've looked at this. You say that the government's going to be mandating stuff. They got very creative. They decided to create not a public option, but a private option. They're being creative with their Medicare dollars. They're bringing in insurance companies.
With Medicaid dollars.
I'm sorry, you're right, with Medicaid dollars.
Medicare dollars.
Fair enough. Medicaid dollars. They're being creative, though, and they're creating little marketplaces where people have choice. I think
How'd that happen?
But it happened because you had Republicans and Democrats come together and get creative.
No, you had this administration grant them an exemption for that program, but not grant Oklahoma one for theirs. Why? Because they have a Democrat governor.
Well,
Oklahoma has a Republican governor, so when we asked for something very creative, we were told no.
We got a Republican governor. We weren't told no on things. So
did you have a reformed Medicaid plan? No, you're just expanding Medicaid.
That's actually not true. But let me also just say, all of this, as we look forward, we have to remember where we have come from here. The millions of people that couldn't find any kind of insurance or paid a lot of money, got almost nothing. When they got sick, got kicked off. I mean, what we're talking about is how do we make this better? I'm not even suggesting that this is perfect. No, we don't need to work on things together.
Perfect.
But I can tell you it's a whole lot better than what tens of millions of Americans have, and women who've been discriminated against on their rates, who haven't been able to get preventative care,
Here's the assumption behind what you're saying, is that the government can buy your health care for you.
This is not about government.
Oh, yes, it is.
No, it's not.
That's why it's cost $1.3 trillion over the next 10 years.
You are going onto a website and you are going to pick out your own insurance policy.
You're not going to. You have to, Senator.
You have to.
You have to.
Listen,
that's an offense.
No,
that's an offense.
We're going to have both of these guys back here because we have about 20 more questions we didn't even get to. But I got one last one I want to ask. Now, listen. The Constitution says you guys have to keep your salaries. Americans are mad about that. You've got Congress people in the Senate. You've got this young veteran, Tulsi Gabbard, in the House, says she's going to give her salary back. People are going to give their salaries to charity. My last question to you guys, who are you giving your salaries away to? I'm sure you won't keep them because your poor staffers. You're good people. Your poor staffers are suffering.
My staffers are working.
Yeah, but without pay.
No, my staffers are working with pay. Right now, they're doing oversight on the federal government.
Good enough.
They're continuing to work on the waste.
But there are 800,000 federal workers
That's
not
right,
taking their pay.
and nobody's for that.
Are you going to keep your salary?
Absolutely, I'm going to keep my salary and going to make sure I spend it and tithe it and give it to charities and do the things that I've always done.
Good for you.
But I'm not going to stop working.
Good for you.
80% of my staff, unfortunately, is on furlough. I'm going to be contributing mine on a daily basis. For every day we are not seeing a government that's open, I'm contributing.
Thank you so much. Very good.
Okay, well, thank you to Senators Stabenow and Coburn.